So obviously, with behaviour changes, can you just talk to me about, some of the changes that you have seen?
Yes, yeah. Changes in behaviour. I've seen behaviour that sometimes can be aggressive. Okay. I've also seen changes in behaviour where it appears as though maybe aggression or the opposite to aggression, love, sympathy, empathy, that has gone as well. There are changes in eating, there are changes in sleeping, there are changes in perception, as I've said before, perception of what is around you, what you're hearing. There is a change. There can be a change with some people with dementia where they will struggle. They'll know the word they want to say, but they can't say the word. They'll say another word, which then adds to confusion, especially with family.
And when you're faced with, those behaviours, I know that we do a lot of training on supporting our staff how to deal with that, because the last thing that you want to do is make the situation worse for the person who's in that moment. Now, we know that sometimes with dementia, people will regress backwards. They may go back to a moment in their life where they feel like they're currently in. Now, if you were to go to a client and say that they put some butter in the fridge or they did something like that and it wasn't sort of classed as what the behaviour should be, how would you approach that?
So, sense of humour. Sense of humour is key to all of this. And there's almost, I speak to staff here about, sometimes you've got to play a little bit of a game. You've got to use humour. Music is key to all of this as well. I train my staff and say to them that when you're working with someone with dementia, you have a playlist of songs that your client likes, and you put that on in the background because believe it or not, a lot of our clients, I do go to their houses and they love music, but they don't have any music on. They don't have the radio on. So I sing to my clients. That's something I do and it works for me a treat. So music is key, humour, and just, you've really got to put yourself in the shoes of someone, and it's very easy. I've seen it in care over the years where unfortunately sometimes we as carers and families make the situation worse, and we need so there's a lady I think I was talking to before we started in the United States. She's called Teepa Snow. And if you want some really good information about dementia, then check her out. But she uses a very American phrase which is, you got to take time out, step away, look at the bigger picture, seek help, and don't be too judgmental.